Germany has reported its highest 7-day incidence rate of COVID-19 cases yet, with infections registered at over 900 per 100,000 people for the first time. Health authorities recorded 164,000 new cases in a single 24-hour period. The rise is driven largely by the dominant Omicron variant. The German parliament is set to debate compulsory vaccines later today. The government has already passed legislation that will make vaccines required for healthcare workers from March. Unvaccinated staff could be banned from work or even fired. We spoke to a nurse who works in a COVID ward herself, but says she won't get vaccinated, whatever the risk.
Today, Sabine Schröder is working as an alternative practitioner. She offers her patients homeopathy treatments. On other days, she works as a nurse in an intensive care unit. When the pandemic started, she volunteered in a COVID ward. Even local newspapers reported on the story. It is a smaller intensive care unit, but over 50% of it was occupied by coronavirus patients. During my shifts, I really experienced how desperately patients were struggling for air. That really got to me. From her own experience, she knows that the disease has cost many lives. However, she doesn't want to get vaccinated against COVID-19, even though it will be compulsory for healthcare workers in Germany from March. Instead of being vaccinated with a vaccine whose effect I can't assess, I'd rather catch the virus. Of course, that could go badly, but then I would rather accept death on my own terms. Lawmaker and Dr. Paula Pischotter voted for compulsory vaccinations. She wants to prevent patients from being infected by nursing staff. For all of us working in healthcare, it is our job that we do not put our patients at unreasonable risk. And the COVID-19 vaccination is extremely safe, which is why it is acceptable to enforce it to protect our patients. Sabine believes in alternative therapy, not in vaccinations, despite all the scientific proof that they work. Most healthcare workers are vaccinated, but Sabine could now lose her clinical job. Should that really happen, and my employer would say, "We are a danger to the patients," then I will accept that. Then I will not work there anymore. She would then be missing out on several €100 a month, but that won't change her mind. She says she will remain unvaccinated.
Well, for more, let's bring in our political correspondent, Emmanuel Schaz. Emma, German parliamentarians today are debating a blanket mandate for COVID-19 vaccinations. What are they considering exactly?
Well, Terry, what's really important to realize what's happening today is not a vote. It is a round of discussions only. There's no mandatory vaccine that will be decided here in Germany today. Parliamentarians of all parties in favor or against the mandate will debate between themselves on whether or not they want this mandate to be voted and on the feasibility of this mandate. They're supported in that by Federal President Frank-Walter Steinmeier. He had highlighted a few days ago how important that debate was. He said that, of course, the state is under pressure to act timely in these times of pandemic, but also he said that this didn't replace the requirement to weigh up arguments and balance interests that are at stake. This is precisely what we're going to see today in the parliament, and it's a very hotly debated topic also here within the German population, even if 2/3 of the population are actually in favor of a mandatory vaccine. It's not really black and white, and maybe let's listen directly to what some people had to say about a mandatory vaccine.
Ja, ich weiß es nicht. Also
I don't know really. It's probably right to make it mandatory for people who work a lot with others, from teachers to healthcare workers. Overall, I'd say that I'm in favor, but also that I'm not sure.
aber sage auch, ich weiß es aber nicht sicher.
I'm personally against making vaccination mandatory for some groups of the population only, for example, for healthcare workers. To me, this would be the worst solution, and I say either you make it mandatory for everyone or for no one.
Sollte jeder machen.
Everybody should do it.
Natürlich.
Of course.
Jetzt ist der Ansturm groß.
Now there's a big rush, but people have had so much time to get vaccinated.
Ich hab's ja auch
I've also
gemacht.
done it, and I just think it's the right thing to do.
Also eigentlich war ich
I'm in favor of making vaccination mandatory because I think that everybody should watch out for each other and make sure that we get out of this pandemic at last.
Pandemie mal zu Ende geht.
Emma, if the German parliament does end up approving a blanket vaccine mandate, do they have any idea how it could be enforced?
Well, here's where it might be difficult for Germany. For one, even within the governing coalition, it might be problematic to agree on a mandatory vaccine. While they agree that a general mandate could be implemented, they agree on it only for people over 18, for example. Not all members of the coalition would also go for a mandatory vaccine. Free Liberals, Wolfgang Kubicki, for example, he's the vice president of the Bundestag. He warned that a mandatory vaccine would have little effect on the unvaccinated here in Germany, and that it would only lead, in his opinion, to a wave of administrative hurdles, with the fines being issued against unvaccinated. And both the Greens and the FDP, the Free Democrats, would be in favor of a mandatory vaccine from a defined age only to protect the most vulnerable. So they would have to agree on that, and of course on how to implement it within the population.
Mandatory vaccines, highly controversial. Our political correspondent, Emmanuel Scholz, thank you so much.